Morning, everyone. Today we are going to discuss about the surveyors. Surveyor and survey are mainly used for the fabrication of the cast partial dentures. When a patient is coming for a cast partial denture, initially we will make a diagnostic impression and diagnostic cast will be fabricated. And this diagnostic cast we will do as diagnostic surveying, and we will find out where the whether the guiding surfaces are parallel or not, where the undercuts are present, how much of undercut is there, whether we have to do a modification for these undercuts, whether we can do the modification by doing just an enameloplasty is enough, or if too much of undercut is there, we have to go for a restoration to reduce the undercut in those areas, whether hard tissue undercuts are present or soft tissue undercuts are present. Everything we will plan by using a diagnostic cast. So without a surveyor, we cannot plan all this for a diagnostic cast. After that only we will do a mouth preparation. And during this mouth preparation, whatever corrections we will do everything. And we will exactly, we will decide where the ground or where the occlusal thrust has to come, where the direct retainer has to go and engage the undercut, what should be the major connected design, everything we will plan. And after that, again, after the mouth preparation, we will make a master final impression. And by using the final impression, a master cast will be fabricated. Again, by using this master cast, we will do the surveying to finalize the major connector design, where the position of the occlusal thrust and the position of the direct retainer and undercuts, or whether the favorable undercuts where it is present. Everything we will mark it on the master cast while doing a surveying again. And after that only we will fabricate the wax pattern by duplicating the master cast. That is another lab procedures which are used for the fabrication of the cast partial denture. So we will be doing the surveying two times, mainly for the diagnostic cast and for the master cast. And sometimes after doing the blockout procedures, again we will be repositioning the master cast on the surveying table to find out whether any excess contour, excess wax is there, and we can use a wax cover to remove the excess wax. Everything we will do on a surveying table again. So we will be seeing what are the different types of surveys, what are the different parts of a survey, and what are the main uses, why we are using a surveyor. Everything we will be seeing here. So to define with the surveyor, surveying is defined as a paralleling instrument used in the construction of the processes to locate and delineate the contours and relative position of abutment teeth and associated structures. Or it can be also defined as an instrument used to determine the relative parallelism of two or more surfaces of teeth or other portions of a cast of the dental arch. So why this parallelism is more important for fabricating a cast partial denture? So what we have to understand is, when we are making an acrylic partial denture or is a temporary denture, when there is an undercut or when the denture is not going inside the patient mouth, we can do a gross trimming. Trimming is very easily we can do, and we can adjust the denture and we can insert the denture to the denture that for that patient. But when we are fabricating a cast partial denture, we have to understand it is a metallic denture. Metal is there. So when undercut is there, very easily we cannot trim the denture or we cannot make the gross adjustments on the cast partial denture. So that's why we have to find out where the undercuts are there, whether the guiding surfaces are parallel or not. If guiding surfaces are not parallel, the denture will not go inside the patient. So why before fabricating the wax pattern itself, well before that we have to understand all that, because adjustments are not possible for a cast partial denture. So we have to find out the parallelism and the favorable undercuts. So without using a surveyor, when multiple surfaces are involved, without a surveyor, by just with the eyeballing, it's the procedure prior to the use of surveyor. It is called as eyeballing, because we will keep the cast in a distant area in a on our arm, and we will analyze the cast, and eyeballing will be done and to find out the parallelism. But when multiple surfaces are there, it will be various mistakes will be there, and we cannot fabricate a processes accurately. So surveyor is important. Dr. A.J. Fortunati is thought to be the first person to employ a mechanical device to determine the relative parallelism of two surfaces. So there are mainly two surveys. What is the Ney surveyor and another one is the Jalango surveyor. So these are the two. There are a lot of surveys, but these two are the main two surveys which we are using for the fabrication of the removable partial dentures. And since these are the two main classes, we have very differences. Main differences are there for these two surveys, where the one analyzing arm is suspended or when for one spring loaded. So some kind of major differences are there between these two surveys. So the first such device to be produced commercially, the Ney instrument was made available in 1923. It remains the most widely used surveyor in the dental field and is a wheel surveyor by Jalango, the second most widely used surveyor. So Ney surveyor and the wheel surveyor. Wheel surveyor is sometimes also called as Jalango surveyor. So these are the two main classes of surveyors. So what are the aims and objectives of surveying? So to determine the most advantageous path of insertion or removal of the RPD. So most advantageous path of insertion or removal means for a Kennedy's class 1 and Kennedy's class 2 situation where the posterior most teeth are missing, when we are trying to insert the denture, we will be having multiple path of insertion because there is no tooth bounded area in between because there posteriorly it is an edentulous area. So when we are trying to insert the denture, we will be having multiple path of insertion. But when it's a tooth bounded, like in a Kennedy's class 3 or a class 4 situation, even it will become more complicated because it is a tooth bounded area. Exactly where we have to find out where the undercuts are there, where the paneling surfaces are there, where the favorable undercuts are there. Only then the denture will go inside because the path of insertion or path of removal is very minimal. Only one or two path of insertion will be there. In that path only, the denture will go inside. Otherwise, there will be some interferences and the denture will not go inside. So that's why I told before fabricating the wax pattern itself, we have to find out where these undercuts are present. That's why we are doing surveying for the diagnostic cast and for the master cast. And to locate the proximal tooth surfaces that are or can be made parallel to act as guiding surfaces. So guiding surfaces means when an edentulous area is there, the surface, the proximal surface adjacent to that edentulous area, that surface is called the guiding surface. So whenever possible, that surface has to be parallel to each other. And to locate and measure the undercuts for mechanical retention. So mechanical retention means when we are engaging the undercuts by using the retentive terminal, the terminal will go and engage undercut. So it will not, when a severe undercut is there, we don't need to use a severe undercuts. We will use only minimum undercuts like 0.01 inch or 0.02 inch, etc. will be used for the engagement of the under means for the retentive purpose. So we have to measure these undercuts and whatever area is there below these undercuts, we have to do block out because they are called unfavorable undercuts. So favorable undercuts, we will use it for the retention and the unfavorable undercuts, we have to do blockouts. So these undercuts, we have to measure accurately by using the tools which are used for the survey. So for what are the tools which are used that I will be showing, and to identify areas of potential hard or soft tissue interferences. So hard and soft tissue interferences means mainly in case of the maxillary tuberosity, there will be sometimes bilateral undercuts will be present. So when bilateral undercuts are there, it will be very difficult to insert the denture for the patient because bilaterally it is interfering the path of insertion of the denture. So it will traumatize the mucosa and it will cause the patient will not be able to use the denture properly. So they say that at least one undercut has to be removed. One undercut we can use it as a favorable or we can make it used for the retention purpose, but another undercut has to be removed. That means surgical undercut has to be removed. Another one is the sometimes even the tooth is inclined too much. If the tooth is inclined too much, we cannot correct it by using just an enameloplasty. Enameloplasty will not be enough. So in those cases, we have to go for restoration. We have to do an RCT or sometimes without RCT, we have to give a crown or we have to modify the tooth surfaces to uh, make it favorable for the denture insertion. So these undercuts, hard tissue or soft tissue interferences can be analyzed and be identified by using the survey and to determine a path of insertion or dislodgement consistent with the aesthetic requirements. So mainly for a Kennedy's class 4 situation where anterior teeth are missing. So in those situations, If the surveying is not done properly, if the cast framework is not fabricated properly, it will cause some aesthetic concerns also. Like when the danger is inserted, the class will be in a visible area. So we had along with the other things, we have to see the aesthetic concerns of the patient also. 6th point, to delineate the height of contour of the abutment teeth and identify areas of undercut that must be avoided, reduced, blocked out, or preserved. So this one I mentioned already. Like if the undercuts has to be avoided, either it has to be avoided by using a surgical method or by using a modification or a restoration. Mild undercuts are there means it can be reduced by using an enameloplasty or mild corrections. If severe undercuts are there, if cannot be removed, we have to do a blockout. And the favorable undercuts, we have to preserve that and help in planning restorative procedures and to record the most ideal cast position for future reference. They're talking about the tripoding of the cast. So I told you previously, mainly we will be doing surveying for the diagnostic cast and also for the master cast. So after doing the surveying for the master cast, we will be removing the cast from the surveying table and we will be doing the blockout. After doing the blockout, again we can keep it on the surveying table or surveyor to analyze whether the blockout is done properly. So when we are keeping it or repositioning the cast back to the surveying table, it has to be repositioned in the same way how it was surveyed previously. So if you want to reposition a three-dimensional object in its space, three distant points has to be marked. So same way on the cast when we are doing the master cast surveying, three distant points will be marked on the master cast away from the designing area, like wherever we are planning the major connector. Away from those areas, we will plan the uh, tripoding marking. 3 points will be marked. So after that, when we are repositioning, we will make sure that these 3 points are in the exact same position as we marked previously. That's how we can reposition in the accurate position, accurate, accurately. So that is called tripoding. So tripoding also can be done by using a surveyor and to establish a formal plan of for RPD design and the required mouth preparation. So this also we have seen and the surveying. So these are the different parts of the surveying. So we have a vertical arm and a horizontal arm is there. And from the horizontal arm, we have a analyzing or the surveying arm suspended from the uh, horizontal arm. We have a surveying table is there. Over the surveying table or the surveying platform, we have the base on which the table swivels, and we have a surveying table. So surveying table, the explanation about each of the part will be seeing in the coming slides. And these are the different tools which are used for the survey. So one main tool is the analyzing rod. Analyzing rod is a cylindrical instrument which is used for surveying or to analyze whether the guiding surfaces are parallel or whether the undercuts are present or not. Present or not, just present. We are not measuring any undercuts or we are not seeing anything else, just we are analyzing. And after analyzing, we will be changing that analyzing rod with a carbon marker. So carbon marker, it is more like a lead pencil or a lead where we'll be able to mark the height of contours. So when we are running the carbon marker around the surface of the tooth, wherever there is a height of contour, that points will be marked. So we will get a survey line. And according to that survey line only, we will plan where the undercuts are present or where the retentive terminal should go and get the undercut. Everything will plan according to the survey line. And there is a classification for the survey lines. And another one is the undercut gauges, undercut devices. So I told you we have favorable undercut and the unfavorable undercut. In that favorable undercut also we had different depth which can be used for the undercut to engage the retentive terminal. That will be accurately measured by using a undercut device or undercut gauge. And the wax carver. So wax carver is used after the blockout procedures or the blockout, different types of blockout like the arbitrary blockout, parallel blockout, shaped blockout, different types of blockouts are there. So after doing the parallel blockout or the arbitrary blockout, we can reposition the cast on the surveying table, and by using a wax carver, we can remove the excess wax from that area. So that is a tool which is used. So this is a picture showing the undercut gauge. So in that triangular space, we can exactly see the lip of the uh, measuring or the undercut gauge will be touching the cast surface. So in that area, we can exactly see how much of undercut, how much depth undercut is present in that area. So these are different parts of it. So where